So I'm feeling a bit rubbish today as well. I just feel a bit hangy today for some reason.
I'm the same.
Yeah. Do you think it's
Yeah, I'm
change
a bit
weather or
like, whoa.
something? Yeah. Just feel a bit down on what's going on. So yeah. Okay, let's just kick off this and let's get it done. I'll take a minute. I'll take five minutes at the most.
Okay.
Hi, welcome to Let's Talk. I'm Claire at Dundee Carer Centre, and today I have got Steph from the corner with me, who's going to be talking to us about young people's health checks. Hi, Steph.
Hi.
How are you doing today?
Yeah, good, thank you. Excited to
Good.
do this.
Yeah, me too. I think it'd be a really good topic for people to hear about.
Yeah.
And I appreciate you coming along and taking time to do this with us on Let's Talk. So, Steph, I'll just hand over to you. Could you tell people today what young people's health checks are all about, please?
Yeah, so I'm part of the Young Carer Outreach team at the Corner Dundee, and I work part of the Young Carer Outreach team, and I have a colleague called Angela, and we implement health checks to young people across Dundee. So this is one of the first health checks that have been offered to young carers. So if you are a young carer in Dundee under the age of 26, you're entitled to come and get a health check. Now, when people hear health check, they think, oh, do I need to do a urine sample? Do I need to get a blood test, blood pressure? It's nothing like that at all. So what it is basically, it's a questionnaire that's done in private, it's confidential, and we don't share that information of the questions that you answer with anybody. And what it is like it's looking at all aspects of a young person's health. So it could be your physical health, it could be emotional health, sexual health, it could be looking at things like finances, mental well-being, but not just for the carer, it could be for the person that they care for as well. Okay. So there's questions in there such as, are you worried about your own mental health, or are you worried about somebody that you lives with mental health and physical? We'll ask questions about, are you registered with a dentist? Have you been to the optician lately? When was the last time you've seen a doctor? Are you currently taking medication? And it's a very holistic approach to looking at a young person's need. So the hope of the health check is to see, is there any gaps in the need or any unmet need? And the hope is that for myself and Angela to work with a young person to get them the support that they need. So, for example, it could be that they want to be involved in groups in the community, or they would like to be referred to Dundee Carer Centre, and we would make sure that the provisions were put in place to support the young person. It could be that the young person is struggling with anxiety and depression and their mental well-being's not being great, and we would look at ways that we would be able to support that. So the corner has a wide range of services that they'd be able to offer. So if it was something to do with sexual health, we've got the sexual health clinic at the corner drop-in, and that's run by sexual health nurses. We've also got a counselling service run by our 2 counsellors. We've also got an emotional support, one-to-one support that we'll offer, and that's all workers that are involved in that. And then we've got our outreach work that we do as well out in the community, based in the schools. So there's a lot of things that we'd be able to support and help young people with. And then if we don't have that in our toolbox to support, we'll work quite greatly with loads of different partners and stakeholders, and they would be able to get involved in support as well. So maybe referrals to different organisations such as yourselves that would be able to offer a more in-depth approach to that unmet need, or working with the young person together. So it's a very broad health check, looking at loads of different aspects. And all young people from the age under, if you're a young carer from first year, from S3, so we'll offer it to S3 to S6 in all the high schools across Dundee. Okay. And usually there would be like a link care worker that would refer the young people to say, look, they're eligible for a health check, and we would do it with them. So far we've done majority of the schools in Dundee from S3 to S6. But if you don't attend school and you are a non-attender, or you've decided to progress and go to college, we've actually got a partnership with Dundee and Angus College as well. So we'd be able to work with like the learning engagement team there and student support services to offer that to other young people. We've also got partners with like employability programs such as Helm, and they would be able to refer people if they felt they needed a health check. There was Keep Well checks that the community health nursing partnership team did. So now if you are a young carer, that would be directly forwarded to myself and Angela at the Young Carer Outreach team, and then we could offer the health checks as well. So there's a vast way that you could be offered a health check, and you could also do it by self-referral as well. Okay. And it's an opt-in process. So if you are a young carer and you felt, I don't want to do the assessment, you don't have to do it. But sometimes we do the assessment and nothing comes up, and then there could be something small that we could potentially help with.
Wow, I just think that sounds fantastic. And
Yeah,
I think when people think of a health check, it's like, let's get a blood pressure taken. Like you
yeah,
say, let's get urine sample. Let's do this,
yeah,
let's do that. But it's the whole bigger picture, isn't it, of how
yeah,
identifying somebody's health, but it's not just like it's not just a health check, it's the whole impact of it as well with your how you're feeling, how your care notes maybe making you feel, and how
yeah,
be it things within schools are making you feel, and how other things are there to help you kind of combat that as well, or help you support that. I
yeah.
think that's the important thing, isn't it?
It really is. And I think as
Mm-hmm.
well, with a lot of young people in schools and they're there 30 hours a week, 9 to 3,
Mm-hmm.
Monday to Friday, there is a lot of other services that could be supporting as well. So if they
Yeah.
are based in school, it's about making the links with different partnerships, such as Children and Family Service, Dundee Carer Centre, Dundee Nangus College,
Mm-hmm.
and all the other third sector organisations that are involved in young people with youth work and things. And
Yeah.
it's about a more collaborative approach to
Mm-hmm.
ensure that there isn't any unmet need. And if there is, what can we all do as services to provide this level of support to young people?
Mm-hmm.
And the uptake that we've had has been high for getting
Good.
these health checks. And there's been a high number where maybe 50% aren't actually needing any additional support, that all that support is in place,
Mm-hmm.
but there's maybe it could just be something quite small that we could help with, and it massively impacts that young person and really benefits and enhances their well-being. And that was really the purpose of it. And
Mm-hmm.
adult carers were offered this health check, but this is the first local authority to say, well, what about young carers? What can we do for them? And grab that early, sort of like an early intervention, or even
Definitely.
especially a brief intervention, because sometimes it
Yeah.
doesn't need to be long. We could do it in shorter spaces of time as well.
Mm-hmm. And I think that's the main thing, isn't it? That early intervention. So we're not looking for people to come out of school and then
Mm.
still be with all these issues that's going on in their lives. The earlier you kind of get in there in the first instance and they put the support in place, the easier it is for people to get that balance
Yeah,
and to lead a
definitely.
healthy, well-being life, hopefully. That's the plan, isn't it?
Yeah, and a lot of the time when we meet with young people, sometimes what they think is something that can't be helped with, it's actually, well, if we could do this, this
Mm-hmm.
might actually benefit. And then they go, oh, I actually never thought about it like
Yeah.
that. And then we learn from them as well.
Mm-hmm.
So they're the young carers, they're the ones with the responsibility and they've got that experience. So it's good
Mm-hmm.
for us as workers to learn from them and say, well, what would benefit you? What could we do to help? And it's great the response and just having that informal consultation with a young person and to get their inside views and to and it's good for us as like a team to work with loads of other different services such as yourselves and
Mm-hmm.
like, well, what is going on in schools and what other programs is there, like the young carers
Yeah.
groups that are on in the high schools across the city, and being able to refer into that. Or
Yeah.
if it is something that maybe is needing a bit of support and counselling, then we've got the avenue that we
You've
could
got the
like
support
go
there.
down.
Yeah. Yeah. Good.
Yeah, it's really
Great.
worth
And
it. We're
I
enjoying
think
it.
it is. It sounds amazing. It sounds good. It looks like you're having a great time with it all, getting involved in all these
Yeah,
different things. And I think you're right. It's connecting these dots, isn't it? And just making people aware
yeah,
of everything that is available because there's so much out there that people just don't know about. And although we're trying our best to get the information out there, that kind of conversation is the best thing still. The word of
yeah,
mouth, isn't it? And let people know this is here
definitely.
for you.
Hmm.
So no, it sounds really good, and it's great to hear you've obviously like been through all the schools in Dundee so far and provided that service to people. Now, when you come to, did you say it was more like a questionnaire style
Yeah,
chat at the beginning?
so when somebody would normally attend like the corner drop-in, when you come
Uh-huh.
in, confidential, and when you're taken into a room with a worker or one of the nurses,
Hmm.
we'd usually do like an initial assessment to see where we can help, where we can support, and where the need is.
Right.
So our assessment is tailored to specifically to young carers.
Hmm.
So it's just me and the young person, or Angela and the young person, and we just go through like a list of questions. And if there is like a sensitive question that we're going to ask, we prepare them beforehand and we go through all the confidentiality. The young person will sign a consent to say that they consent, and this is these they're still, because they're NHS, they're uploaded to like sort of their NHS file and things, and the young person is made aware of that.
Okay.
So if you did think there was something, maybe if you were a young person that wasn't identified as a young carer, but you wanted to get some support and help, you could also go down to the corner drop-in, which is
Okay.
open Monday to Friday, 1 p.m. to 6 p.m. Go in, and then there's like a sheet. You could sign where that you want to go. It's confidential. They don't ask your name when you go to the door. It's just a little form. It's got numbers on it and you just tick. So say you were worried about your well-being, you would maybe tick number 1 and then somebody would take you and then they would do that type of assessment with you to see where they could best support you and what fit would suit you as an individual as like a person-centred approach. Or if you were going down for like sexual health, they would then get somebody that could help with that situation as well. So it's sort of tailored to the young person and trying to develop their relationship-based approaches, but in a person-centred way.
Good. And it's good they've got that option where it could be within the school, or if they feel they want to do that, have that chat out with, they can visit the corner and do it there when and if they want to do that. And I suppose it's good to have that choice, isn't it?
Yeah, so if they did hear about it in the schools or at college or out in the community or through the community nursing team, they could contact us directly and we can arrange an appointment through the booking system, or usually there's myself or another member of staff upstairs in the office from the Young Carer Outreach team. So if somebody was to attend drop-in and we were available, we could potentially go down and do that assessment there. Because I know for some young people it can be nerve-wracking going and speaking to a stranger that you've not met before, and when you hear health assessment, like you say, or health check, you think, I'm not wanting my blood taken.
No,
I don't want to do urine sample.
Yeah.
And that's understandable because when I hear health
definitely.
check, they're the things that I think of first. And it's
Exactly.
good for young people to learn that health is, it's not just the physical side of things. It's a whole approach to your own domain and your own well-being, and giving them the autonomy over their health and their lives and giving them the tools that they can take away with them, which is going to build them up, really.
Yeah, good. Well, I think it sounds great. And I think if there's people who is listening to this today that obviously have any young people who they are in their lives or young carers, to get in touch. And we're going to put all the contact details in the comment section below. So we'll put in Steph's details for the corner. And again, if there's maybe somebody within the school you'd rather speak to about this, approach somebody in the school and they will be in touch with Steph and the team at the corner as well regarding it. But yeah, I think it sounds fantastic. It's a great opportunity for young people to get that full check done as well, and get that support earlier than later would be good.
Yeah.
Perfect, Steph. Well, Steph, thanks again for joining me today on Let's Talk.
Thank you for having me.
And hopefully, if we do have any comments on that, I'll get them across to you, and we can get back to everybody in due course.
Great. Thank you very much.
Okay. Thanks again, Steph. Take care.
Take care. Bye-bye.
Bye. Right. I'll just end it, Steph. 2 seconds.